warm up before we start with the presentation. Can you define these three terms below? Yes. Embolus is the blood clot circulating in the vessel until it lodges a smaller vessel. Hypoxia is the lack of oxygen in cells of the tissue. Ischaemia is the reduced or restricted blood flow to the tissues. There are two types of limb ischemia, which is acute and chronic. Acute is the sudden decrease in limb perfusion that threatens the viability of the limb. The main signs and symptoms can be described using 6 P's, which are pain, pallor, helplessness, paresthesia, perishing wrinkles, and paralysis. Acute limb ischemia is a surgical emergency, because which then will lead to irreversible tissue damage within 6 hours if it's not treated. Chronic limb ischemia is a peripheral arterial disease that results in a symptomatic reduced blood supply to the limbs. It's commonly caused by atherosclerosis. Initial presentation could be asymptomatic, which then followed by intermittent claudication, ischemic resting, and ulceration of gangrene or even both at stage 4. Surgical intervention is required if conservative management is given.
So, what are the etiology of acute limb ischemia? Remember who's ETA just now? ETA refers to the 4 main causes of acute limb ischemia, which consists of embolism, thrombus, trauma, and aneurysm. If so, which etiology is the commonest? Can we all make a guess? Yes, the answer here would be embolism, and which would be the main content of our video today. There are 2 main sources of embolus, which are cardiac emboli, which is most likely cause, and the non-cardiac emboli, which arises from the arteries where there are presence of atherosclerotic plaques, or an aneurysm, which is less likely to cause a big arterial occlusion. Cardiac emboli is the most likely source with presence of 80% of all embolus, and among the cardiac emboli we have, 70% of it is due to atrial fibrillation, 20% is due to acute myocardial infarction with left ventricular neurothrombus, whereas a smaller proportion are due to prosthetic heart valves if they are not receiving any anticoagulant therapy.
So where does the emboli usually lodge to? The most common place for the emboli usually lodge to is the bifurcation of the femoral artery, followed by trifurcation of popliteal artery, and aortic bifurcation, external and internal iliac artery, and the arm. You must be wondering, where is the bifurcation of the femoral artery and the popliteal artery? So the bifurcation of the femoral artery is usually near to the groin crease, and for the trifurcation of the popliteal artery is usually near to the knee crease. Lastly, these are the important factors that cause a person to have a thrombosis from Virchow Triad, which is stenosis, endothelial injury, and hypercoagulability.